Amolata district is one of the newly created administrative units in the northeastern part of Uganda. Access to Amolata can either be by road, where you literally have to cover many kilometers through Soroti district in the east or Lira in the north. However, the shortest route is by boat on Lake Kwania. An hour of ride on these usually rickety boats from Nakasongola in central Uganda could get you to Amolata. In fact, the district is located in a very hard-to-reach corner of Uganda. Many lives have been lost on this lake as people use boats for transport.
Transport across the water, the lake, has also posed a big challenge to the organization because we have patients that come from across the lake. They use canoes, they use motorboats, but sometimes they are attacked by windstorm and rainstorm. People have lost their lives in this lake. We therefore feel in future, if we could improve transport across the lake using a ferry other than the canoes and the motorboats.
The biggest and most outstanding health facility is Amai Community Hospital, which at times can be overwhelmed by the sheer number of people seeking medical attention, including communities living at the lake shore. The hospital is an initiative of Polycare Foundation, a British and a Ugandan charity founded by Dr. Washington Ayuko and Mrs. Margaret Ayuko in 1994. Polycare work is centered in northern Uganda, East Africa. These areas had been destabilized by civil war for the past 22 years. In fact, the geographical location of Amolata put it within striking distance of the marauding LRA rebels that devastated northern Uganda for more than 20 years. It was sandwiched between the insurgents and the Karamojong cattle rustlers from the eastern border of Uganda.
Polycare is a 16-year-old organization, started way back in 1993 and was initiated by Professor Washington Ayuko. While he was in Britain, he kept reflecting on the problems the people were facing back in Uganda and develop project ideas to contribute and improve on the lives of the people behind in Uganda. He went ahead to raise some resources and funds, which led to the initiation of this organization here in Uganda.
The hospital provides numerous services. There are about 435 inpatient services, 371 outpatients. Some of these need laboratory services, blood transfusion, immunization, community health education, major and minor operations, X-ray services, ultrasound scan services, orthopedic services, maternal and child health services, and family planning services, among others.
It's a hospital, and being a hospital, the services are a bit comprehensive. We are handling inpatient services ranging from all medical cases to surgical cases. We are even able to perform major operations within the hospital. So there is a bit comprehensive. We also have the community component. The community component, we have outreach services. We are doing immunization within the unit, what we call the static work, and then we are doing the outreaches out there in the communities. So some of our few staff, they go out in rotation and they conduct these outreaches, immunization, and also HIV/AIDS outreaches. We have actually trained a number of community volunteers within the community, and they're helping us track patients who are really within the communities so that they can access service within the hospital.
But now, with peace returning to the greater north, Amolata is picking up her pieces to move on as people embark on their daily chores without a sense of fear. Since its establishment in 1994, Polycare has constructed and equipped this 100-bed hospital, and now it acts as the major health referral facility for the entire district from the lower health units within the district.
The Amai is our referral hospital as of now, and we appreciate the fact that Dr. Ayuko has contributed so much to this, without which we would not be having any referral health unit in this district. We have the health center 4 here, which is a government one. The theater is not yet operating because we don't have equipment.
But again, when you look at the location of my community hospital, we are bordering a patch. Just about 8 kilometers out here, you're already in a patch. This side, you're already in Dokolo, and the other side, you're in Kaberamaido. So we handle mainly cases within Amolata and part of Apache Nambiso, part of Kaberamaido, and then part of Dokolo. So you find all those patients, they come and access services from here.
The hospital currently employs a total of 6 staff, including 2 doctors and other staff of various categories.
Medical Superintendent? Yeah, I'm called Dr. Moses Sachan.
Majority of the population fetch water from the lake at the landing sites, like these ladies with their jerrycans who come for water daily here. This has exposed the communities to waterborne diseases.
The lake water that you're seeing is being used for several purposes. One is that this water, the lake is being used for bathing, is being used for washing utensils, and at the same time, drinking. You find that this is already a contaminated water, and it is causing diseases to the communities around. This then was a prevention mechanism to ensure that the lake water may be used only for washing, but with time we're even discouraging people using that because there are other waterborne diseases. By just touching the water, people could be having skin diseases. Another thing is that the boreholes that were drilled here before was so saline that it was corroding the equipments of the hospital. They would catch rust and would destroy the hospital equipment because it had calcium materials and salt in it. So it wasn't very proper or recommended for hospital use. That then brought the idea of having a clean and safe water that could be used both by the hospital and the communities around.
Water is pumped into these giant tanks and then it flows by gravity to Amai Community Hospital, the school, and the surrounding areas. Thanks to the commitment of Polycare Foundation, this medical facility has even survived the most difficult times during the rebellion. In fact, the numbers of outpatients now keep on increasing because of the good services the personnel are rendering, which also attracts people from outside the district like from Apache, Dokolo, and Kaberamaido.
We have been able actually to provide comprehensive maternal and neonatal care within the hospital with the limited facilities that we have. We are able to operate. We are able actually to conduct specialized deliveries because of our competent midwives, the registered midwives who are in place as well, much as they are few.
Yet the organization operates on a resource-limited environment. Projects like Amai Community Hospital are being overstretched due to the increase in demand for the quality services being delivered, which is not corresponding to the expansion of the hospital infrastructure like staff quarters and admission wards.
The organization encountered some challenges as well. One most important one is that there has been increasing demand for services from the community, and yet we are depending on, in the past we've been depending on donor money. The locally generated revenue has been so little that could not help us implement or respond to all these various needs that are coming from the communities. So funding has been one of the challenges. When you look at the ward which is hosting or accommodating children, the male and adults and female adults, it is really congested. So infrastructure has been one of the challenges in this hospital. The maternity ward is so squeezed that if 2 mothers begin delivering at the same time, it would be very difficult because of space. We have little space. This has also been a big challenge. The other, of course, is the poverty among the communities. You find that as people come to the hospital to receive the service, they most times can't meet the cost sharing for the service they would demand. So sometimes you end up giving like a free service, and yet we access these services, some of them from Kampala, like the drugs which we bring from joint medical stores in Kampala, we transport it here. So in the end, you find you are operating, much as it is a charity organization, we feel there should be some small co-funding to enhance the continuity of the service for the communities, such that many more people in future would still get the service they would require.
They want a hospital that is a center of excellence dedicated to promote a protected and literate community which is holistically healthy and economically empowered to respond to their needs.
Mainly our focus was about health related, which is a life-saving venture. So we feel, since the hospital intend to be a center of excellence in providing health services within the region, we intend to have ENT services, that is ear, nose and throat services provided within this hospital. There are clients who come, but currently there is nothing we can do for them because we don't have these services at the moment, but we intend to have it in place. Other clients who come from the community also with mental illnesses, we intend to establish a mental health facility within this hospital that can then be comprehensive enough to provide the services to all the members of the communities who do approach us or visit the hospital, other than referring them to other health facilities. Sometimes we refer them because of resource constraints. They end up going back and not going for the services that are provided, like far in the National Referral Hospital in Kampala, that is Mulago. We also intend to improve on the nutritional status of the communities. When you go to the communities, you find that we still have malnourished children. We intend therefore to have food security projects for each and every household within the communities neighboring the hospital. And also improve the water transport by having a ferry that could help us transport patients who move or visit the hospital from across the lake, and expand the hospital to have a bigger theater, because the current theater that we have is that we can only make an operation one at a time. So in future we intend to have a bigger theater so that when other emergencies come, when we already have an operation going on, we can then contain emergency surgeries also taking place in the bigger or main theater. This would also help us in future to invite other consultant surgeons to visit us and help clients who have complicated cases that need highly specialized services.
In an attempt to provide holistic service for the communities to live independent and decent lives, Polycare Foundation intends to use a group approach in order to improve the economic status of the families by acquiring hand-powered tractors, ox plows, and oxen for rotational plowing among group members to improve food production among families for both commercial, income, and nutritional value. From the experience of revolving funds previously granted by Polycare Foundation, a new dimension has been taken on to give a revolving animal through groups. While the challenges seem to be numerous, the silver lining lies on the commitment of the local people to protect what has already been achieved and the goodwill of those kind enough to help the poor. And the fact remains that Amai has had a social transformation and will never remain the same.